There is this absence and this, I guess, isolation that comes with living with a brain injury, and there just aren't enough public awareness, services and public awareness information to really inform you of what's out there to help.
Having a stroke, your brain, as I said in my little quotes, your brain feels like it's absolutely scrambled. It's working at 100 miles an hour and you can't really focus and concentrate. So communication is really critical. And if you're not being told what's happening to you and you're just being shunted from one place to another, it's not really good enough.
Yeah, so I guess my point of view is I've seen so many cases throughout my career where individuals feel really unheard when it comes to brain injury. So either they haven't been diagnosed or misdiagnosed or aren't referred to the right people, or those cases where there's very severe traumatic brain injury and you've got family saying, this is the support they need, but others are dismissive of it.
It's just so important. If you work in the brain injury space yourself and you're a neurosurgeon or somebody like that, you have had these people come to you, but for most people in the community, they just don't know, right? And they really don't know what the lived experience is, which is quite different to what happens in the hospital or in the ward, for instance, right?
Anyone who knows anything about Queensland knows that it has the most decentralised population in the country. So anything that's going to bring the brains trusts of Queensland together to work cooperatively and collaboratively towards better outcomes for people with brain injury is a dream come true.
The collaborative here, it's a fantastic resource. Like all of this information, all of this research, and all of these people who have the same goal of wanting to obtain better health outcomes for individuals by working together.
Look, road crashes are one of the most frequent causes of traumatic brain injury. So helping people who've recovered from such a significant event is really important. The brain being as complex as it is, research is just vital to understanding where can we go, how can we help improve health outcomes and independence outcomes for people.
I think there's many people who experience a brain injury who fall through the cracks, and we need to work together to ensure that people are accessing the services that they need when they need it to optimise outcomes for the future.
We need to understand what the problem is and respond to that rather than always having a supply side solutions focus. We've got to understand the problem and then bring the capability and the talent together to solve that.
What we would like to see, QBIC is one step in a journey towards, whether it's an institute or a centre that brings people together, regardless of their background or who they are, what their role is, so that we can really leverage some of the great things we've been hearing this morning.
Bringing what they're finding out at the neuroscience level into translating it into practice, but having that co-design with consumers on board from day one is really important.
And brain injury is one of those unthought about areas, and we need to make people aware of it and be willing to talk about it, just like anything else that happens in life, rather than something that you should be worried about and scared. I mean, of course you should be worried and scared about it, but if it happens to you, feel free to talk about it and get help.